Despite some of the technical problems the Affordable Care Act is having on a national level, the rollout here in Connecticut continues to gain momentum. Here to highlight the goals of the act and its impact for us at home, our President and CEO of Qualidigm, Tim Elwell, along with Ann Elwell, the Vice President of Community Relations. Nice to have you both here. And last time here we were talking about the Better Health Everyone's Responsibility Conference up at the Convention Center. How did it go?
Oh, it was a great day. It was Good. September 17th. It was the conference sponsored by the Connecticut Partners for Health, and we had over 600 consumers and providers there. We talked about very important issues related to health and healthcare, and we hope that it is just the beginning of a movement in Connecticut to really get folks involved in managing their own health and healthcare.
All right, and today we're going to talk about the Affordable Care Act. It is very complex. Tim, tell us actually how complex it is.
Well, Teresa, the actual bill is over 2,700 pages long.
Wow.
And the Washington Times has, and I haven't read it, but the Washington Times has indicated that there's over 20,000 pages that have been used to explain the bill. Wow. So when we're looking at explaining it, obviously we're all going to be scraping the surface of the
Sure, just the tip of the iceberg. Today we're going to talk about one of the goals, actually.
That's right.
Explain that to us.
So if you go to Secretary Sebelius's website, she actually sets out 5 goals. The first goal that we're going to talk about is really what Qualidigm spends most of its time on. So most folks think about the Affordable Care Act as being the insurance exchange. Mm-hmm. In fact, that's obviously a very important part of what is being rolled out. However, there's also concentration on things like improvement of patient safety, concentration on prevention and wellness, reduction of cost, extension of technologies to both physician as well as patients to be able to improve healthcare delivery.
So it's a lot more than just getting online and trying to sign up. Right? All right, so we're going to break it down a little further and get into some of the objectives. The first one we're going to talk about is making coverage more secure for those who have insurance and extend affordable coverage to the uninsured. How exactly, what's the first step in doing that?
Well, the first step was to roll out the health insurance exchange.
So we're in the process.
So in New England, the Access CT is actually one of the exchanges that's working very well.
Good.
2 out of New England. And concentrating on that is extending health insurance to the previously uninsured, as well as impacting commercial insurance. So, for instance, you can no longer be denied for pre-existing conditions, as an example. I'm a dad. I have a son that's 24 years old. He's also in school. He's not employed full-time. He can now remain on my health insurance plan up until 26, which is obviously an important thing.
Sure.
The concentration also is around the prevention as well as the effectiveness of healthcare delivery, including all of the benefits that are surrounding that.
Okay. And the second one here is improve the healthcare quality and patient safety. We talked about that just a little bit, but you're also working with nursing homes, correct?
Oh, well, Qualidigm, as the Quality Improvement Organization for the State of Connecticut, as well as being a healthcare consulting company, we work with providers across the continuum of healthcare. Mm-hmm. We work with hospitals, nursing homes, home care. But in the nursing home setting, we are very proud to say that the nursing homes, working with others, have decreased their rates of pressure ulcers, which is a condition that causes much injury to people. It's a high-cost condition. We have decreased the rates by about 63%. We have also decreased the use of physical restraints by 89% relative improvement, which is huge. We have 111 nursing homes in Connecticut that are restraint-free. We're also working with hospitals to decrease readmissions and admissions, which are very, very costly and very unpleasant for folks. And we have decreased readmissions by a relative improvement rate of 11% and admissions by 7%,
wow, big
which is huge,
there, yeah.
Just huge.
Another objective here is emphasize primary and preventive care linked with community prevention services. That's really just what you touched upon.
Just what I talked about.
So, Tim, let's talk about the next one, which is reduce the growth of healthcare costs while promoting high-value, effective care.
So I think that actually is what Ann was just discussing.
Sure.
And each one of those statistics that she provided has a dollar amount that's associated with improving not only the healthcare quality, but also the cost associated with that healthcare.
Okay, and then lastly, we want to promote the adoption and meaningful use of health information technology. A lot of resources out there. Is that more or less what that means?
Yeah, and it's at a couple different levels, right? One is we work directly with doctors and their physician offices to be able to provide patient-centered medical home and work with them on the extension of meaningfully using technology and being able to create extensions of that technology so that patients now have access to their health records.
Sure.
So now they have access to personal health records for them to be able to transport, bring that to other providers, but also things like Bluetooth-enabled home care devices are now becoming mainstay. Also, the social
social networks, right?
social network.
More,
I mean,
even
patients
more
like me, as an
opportunity.
example, would be a place where a patient can now begin to link with other patients that have similar types of problems.
Very good. All right, well, let's put the information up on the screen again. We just hit the tip of the iceberg today, but if you're looking for more about Qualidigm, you can go to qualidigm.org. You could also go to ctpartnerforhealth.org and get some more information there. Tim, Ann, thank you so much for the information. You're kind of making sense of a pretty complicated topic.
We hope so.
All right, up next, Chef Deborah Queen shares her recipe for homemade Thai chili sauce. When Style returns, we'll be right back.